Waugh, at times Dr. Barnes, Dr. Kuniak, and Dr. Mitchell have said a child or teen needs to receive professional mental health counseling. So Teen Line is one of the resources in our community that can provide information about mental health resources and crisis intervention. Can you tell us more about what Teen Line is and how your counselors, help those who contact you, who pick up the phone and call?
Sure. Teen Line is a service of Geisinger Holy Spirit in conjunction with Cumberland Perry Mental Health, which is the county mental health agency. And we focus on prevention, intervention, and postvention for mental health of adolescents, kids, and people who care about them. For prevention, we do a lot of community education, such as events like this, but we also train teachers and administrators in schools on identifying students and what to look for and school-based best practices for mental health. For intervention, we act as mental health liaisons to the schools, similar to what Dr. Mitchell was talking about. So we attend the meetings of the specially trained confidential teams that happen, where students are identified and referred, and we can advise on resources for that, but we can also, with parent permission, meet individually with students at a school to conduct a free and confidential screening. And then we contact a parent to get their take on kind of what are you seeing at home, what information can you give us to help us make an informed recommendation for your child. And then we share those recommendations with the student, with the parent, and with the school team. And those recommendations range from formal mental health treatment to in-school supports, again, like Dr. Mitchell was talking about, like if there's a school-based support group or tutoring help. But they also include community resources that we're aware of as well. That's the intervention phase. Postvention we provide to schools and communities when there's a tragedy at a school, if there's a death that would happen either of a student or maybe of a teacher, that we go in, because those kind of supports actually, postvention is prevention. You want to identify those who are impacted by the tragedy that happened at the school and rally supports around those students who are especially closest to that, and in that way, again, providing prevention for the risk factors that might happen. We also take phone calls, so we can talk to students or to parents who may call in and just kind of offer supportive counseling, say, tell us what's going on, have you thought about this, and they can call in at any time for free.
How many calls do you guys get a year? I know that's not on the question list, I'm just curious.
I don't have an answer to that, I don't
Sorry.
know.
See, I know I shouldn't have asked.
They're also confidential. I mean, we do keep track of them, but they're confidential, so.
I was more curious how, for lack of a better term, busy you are. Are you all getting daily calls? Are you, just to put some
Well, I would say, I think with the advent too of the crisis text line, I mean, kids are more sometimes apt to text or use online text resources than a local hotline. We are a good resource if you want local resources, but sometimes kids and teens feel more comfortable using the anonymous method of using crisis text line or an online support system as well. So we're lucky to have more than one.
Right, this next question is on here, I promise. All right, so what are some of the mental health resources available in our community?
Sorry, I'm behind on my slides. Well, some of the things we've already talked about this evening with the pediatrician, through the school, the student assistance program. Every school in Pennsylvania, every school is mandated to have that program, and so there are specially trained counselors and teachers in your school that you can utilize. We are lucky in our area to have a number of professional licensed counselors and psychologists, and Teen Line often knows, if there are specializations such as like equine therapy, art therapy, cognitive behavioral therapy, and we can help guide parents in making informed choices about what kind of therapy would be best for the child's situation. We also know a lot of recreation opportunities, like even the Township Rec Department. And this goes more to what Dr. Mitchell was talking about, finding passion. What is available in the community that can help kids with that. We talk about faith-based supports, and again, this isn't necessarily a mental health formal treatment perspective, but a faith goes back to finding purpose, finding meaning, like Dr. Barnes had mentioned initially when he was talking about prevention and opportunities that occur within faith communities. We also talk about grief supports in the community, domestic violence supports, drug and alcohol supports, all things that may seem secondary but are actually very much connected to the experience of depression for adolescents and are often co-occurring with that diagnosis.
All right, thank you, Ms. Waugh. All right, last but not least,